Hello guys, welcome back to my channel. Thank you very much for watching my channel and thank you for subscribing to the channel as well. My name is Gifty. I'm a midwife working in London. A little disclaimer before I start the video is to say that I'm a midwife. Anything I say here is for information purposes. If you're concerned or you hear something that I say that you are needing more information about, then please do contact your regular midwife or your obstetricians or doctors that do look after you during your pregnancy. So just to let you know out there, please do consult a midwife or a doctor in regarding to your care and in your case in particular. So thank you very much. Just to get into the video now. So this video is going to be discussing about when to go into labor, when to go into hospital when you are in labor. So this is for women who are booked to have their babies in a hospital or in a birthing center, but based in a hospital where you need to attend the location that you choose to deliver at. So if you're having a home birth, then of course this will be not applying so much for you because you are going to be at home calling a midwife to come to you at home. So if you are planning to have a hospital birth or a birth center birth which you have to go to for the delivery, then this is the video for you. First thing to keep in mind is that if you are even having a home birth but you are having this one particular issue, you need to go into hospital, and that is to do with your baby's movements. So if at any point you're in labor at home but you are not happy with your baby's movements, or you're concerned, you haven't felt them, you felt them but not as much as you usually do, or you haven't felt it completely at all, then you need to go into hospital and be seen and to be monitored for your baby to be checked on. So even if you're having a home birth but you're not happy with your baby's movements once your labor begins, then please do go into hospital to be seen, or call your midwives who will be giving you advice over the phone or telling you what to do next. But in most cases you need to go into hospital if you're concerned with your baby's movements. Your baby's movements are the only way you know, and we also know that your baby's doing well. So if you are not happy with them, then please do go into hospital to be seen and to be checked for them. The other thing to also go into hospital for is if you're at home having your labor and you start to see any bleeding at all. This can be really small amounts to a great amount to something in between. If you have any fresh red bleeding, this is not normal. You need to go into hospital to be seen, to be monitored, and to be just kept an eye on to make sure that everything is going well and there's nothing to be concerned about. Or even if there is a problem, then you will be in the right place for this concern to be dealt with. So if you do see any bleeding, please do take yourself into the hospital to be checked. You may have something that is called a show. This is not a concern. So if you see a show, normally it's a very sticky consistency, a little bit like a booger consistency. It could be sticky. Sometimes it may have a little bit of a pinkish, reddish, bleed tint to it, which is a little bit of bleeding as well with it, but it'll be very sticky. It's not fresh red, bright red bleed. It will be sticky, it will be consistent, and it'll be it's nothing concerning. And if you do go in because you're worried about it or you're not sure that it could be a show, then you'll be reassured and then you'll be sent back home if it's not a fresh red bleeding. So it's always worth, even then if you're not sure, to go in to get checked out. The other thing why you go into labor, you go into hospital when you're in labor, is if you start to feel really unwell. So you may feel feverish or high temperature. Always check your temperature if you're feeling unwell. If your temperature is above 38 degrees, then you want to go into hospital to be seen. You may decide to take a paracetamol and see how you get on, but do always check your temperature again after an hour if you've taken any medication, and see if your temperature is lowered back to normal again. If it hasn't and you're still rising, your temperature is still rising, then please do go into hospital to be seen and to be checked that you are okay and you haven't got any infection that needs treatment. And then moving on to your contractions and when to go into labor based on just your contractions. So once your contractions start, you may start off with having them quite a bit far apart. It could be 10 minutes, every 12 minutes, every 7 minutes, every 5 minutes. They're very irregular, and they're not very long lasting. So it will come and you feel contractions for about 20 seconds up to 30 seconds, but not anything that you feel you can't deal with. So of course you don't want to go into hospital then, because the best place for you is actually to be at home when you are in your early stages of labor, because there's not much they can do in hospital, and being at home will give you more relaxation. You feel more comfortable and you feel more at home, be able to move about just as you would like to do. So try to stay at home as long as possible is what we normally would advise. But if your contractions it starts and it goes straight from 0 to 10 very quickly, and you find that you're contracting every 5 minutes, then it gradually quickly moves to every 3 minutes, and it's lasting long meaning it's lasting up to 1 minute or 50 to 60 seconds, and you're feeling like, oh, this is getting really strong. You're not really dealing with it very well, and you're starting to feel like, oh, I think I need more assistance with this, or I need to be in hospital. Just try to do things at home that it will help you to cope as well. So the first thing you want to do is maybe take a paracetamol and see how that goes. Then if you have a bathtub, then we will want you to run a bath. Go and have a lovely nice half an hour soak or so in the bath. If it is a real deal and you are not having just early contractions or early labor stages where it will come and go, then this half an hour bath soak will give you a little time to rest your body, get you to be a little bit more calm, and it will help your body to release all the hormones that is going to help you to go into strong active labor. So by the time you come out, you feel more refreshed, a little bit relaxed, and your contractions will pick up speed again. So don't worry about having a shower if you're at home, or having a bath if you're at home, and this will help you to cope a little bit better as well. There is also taking or renting or buying a TENS machine. This is a machine that you can use to help you in the early stages of labor. It will help to reduce the time that you go into hospital, or help you to stay at home longer, and is a real good benefit for early stages of labor. So before you go into the hospital, it will help you to stay at home a little bit longer. What it does is that it gives little electromagnetic shocks to try and stop the pain signals reaching the brain, and therefore it takes the edge off the contractions a little, and you don't feel as strong as it would be. It doesn't take away the pain completely, but it does take a little bit off, so it helps you to stay at home longer. The point at which you need to go to hospital is when you feel like your contractions are really strong, and during the contractions you are not able to talk through the contraction. So sometimes you have a contraction and your partner or somebody will be talking to you, asking you questions, and you may be breathing through it, but you're able to answer their question. If you get to a stage where you cannot talk through the contraction, so when somebody asks you a question, you hear the question, it's in your mind, you really want to answer the question, but you just don't feel like you physically can answer the question because you are just in too much discomfort, or you're feeling the contractions, or you're in the middle of it and you just need to concentrate on your breathing, on trying to just get through that contraction. Once you start to go into this phrase, it means that these contractions are doing what they need to be doing really well, and therefore maybe it could be a beneficial to go in to either to be assessed to see how well and how far dilated you are, and if it's time for you to actually be admitted into the hospital to be regularly looked after by a midwife. So this is a time where you feel like, okay, I'm not doing well, I need more pain relief, or I need to be in hospital, it's getting stronger. You may also feel like you just feel like you'll be safer, or you feel like you'll be more comfortable being in hospital at this point. These are the times where you need to be going into hospital. Please always keep your hospital or maternity ward in the know of what you're doing at home, how your labor is progressing, when it starts. Just let them know, let them be aware of you that things are beginning to happen and you are on the verge of possibly coming in soon, so that they can make sure that they're aware of you, especially if you're going to a birth center, so they can plan for your arrival, get ready and and get things ready. If it means, you know, running a pool for you to come into, making sure that, you know, there's a midwife available, not on a break. Make sure there's a room for you for your birthing. If you want to use a pool, that they get a room ready for you. So always keep, you know, keep them informed and give them regular updates as well. If it means somebody can call them for you and tell them what's happening and all of that. Okay. Once also, if you're at home and you're having regular contractions, they're picking up speed, they're lasting long, you know, you're breathing through each of them, but you're starting to feel like you need to go in. If your waters do break, okay, this is a time where you need to go in. If your waters break, you need to do 3 important things. The first thing to do is to check the time your water broke, and then the second thing is to put on a pad, and the third thing is to check the color of the waters coming. You don't want the waters to be either yellow or green. These means that the baby's done a poo, and in which case it means your baby needs to be monitored during your labor, and also to be assessed by the pediatricians once baby's born, for them to check the baby is okay. Always give the hospital a call once your water break and make your way in for them to assess you and to make sure that everything is okay and it is your waters, there's no color in there. And also the reason why you're checking the time it happened is that if your waters do break and then for whatever reason you are having contractions but then your contractions stop, or if your waters break in the beginning before your contractions stop, we want you to be at least in active labor, which is when you're contracting every 3 minutes and the contractions last in a minute, for, you know, a real good active labor within 24 hours of your waters breaking. Because once your water breaks, there is no more protection to your baby, so your baby's a little bit more at risk of developing an infection or an infection getting to the baby. So we don't want you to be pregnant more and more, not going into labor within the first 24 hours of your waters breaking. So if this is the case, your waters break first before your labor starts or your contraction starts, then if you're not in labor within 24 hours, you will need to be in hospital for your labor to be augmented. For your actual, what that means is that your hospital will be bringing on your labor by using an intervention such as medication to get you to go into labor. So just to round things up, when you're in labor, the good time or the best time to go in is when your contractions are coming really regularly. They come in every 3 minutes. They're lasting for up to about 60 seconds. And you just feel like you need more help, you need more care, you need to be in hospital, and you will feel safer in hospital. Also, you will not be able to talk through the contractions. So if your contractions are there for the whole minute, you will actually be breathing, breathing through the contractions and not being able to talk or communicate with your loved ones around you. And this means that you are making progress, your contractions are progressing, is doing what it's supposed to be doing, and therefore going into hospital to be checked will be beneficial for you. So I hope you found this video useful. If you have any questions, please leave them in the comments box below and I'll be more than happy to answer them for you. Please do like and share the video if you found it useful, and consider subscribing to the channel and support me to encourage me to make more videos like this, and let me know what you think. So I'll really appreciate your feedback, and good luck for your upcoming labor if you're still yet to go into labor, or if you're nowhere near the labor yet, then congratulations in your pregnancy. Look after yourself, and good luck when your labor begins. Thank you so much for watching my video, and I'll see you in the next one. Bye bye.